So now let's discuss about the nursing care of a family experiencing a sudden pregnancy complication. So the objective for this is first is to describe the complication of pregnancy that place a pregnant woman and their fetus at high risk. The second is use critical thinking to analyze ways that nurses can help prevent complications of pregnancy while keeping care family centered. The third is to assess a woman who is experiencing a complication of pregnancy. The fourth is formulate nursing diagnoses that address the needs of a woman and their family experiencing a complication of pregnancy. The fifth is to identify expected outcomes to minimize the risk to a pregnant woman and their fetus when a complication of pregnancy occurs. Number six is to plan nursing interventions to meet the needs and promote optimal outcomes for a woman and their family during a complication of pregnancy. Seven is to implement nursing care specific to a woman who has developed a complication of pregnancy, such as teaching her how to recognize the symptoms of preterm labor. The last is to integrate knowledge of complications of pregnancy with nursing process to achieve quality maternal and child health nursing care. Pregnancy is one of the most profound times in a woman's life. It is marked by a variety of physical changes, as well as by thoughts and feelings that sometimes overwhelm the mother to be. Though pregnancy is generally a time of joy and well being, complications can occur that cloud the experience and put the woman and her unborn child at risk. So, here are the complications develops during pregnancy. One is the bleeding during pregnancy. Number two is pregnancy-induced hypertension. Three is the HELP syndrome. Number four is multiple pregnancy. Number five is hydramnios. Number six is oligohydramnios. Number seven is pseudocyesis. Number 8 is isoimmunization or Rh incompatibility. And number 9 is the fetal death. So now let's talk about the bleeding during pregnancy. Does bleeding during pregnancy always mean that there is a problem? So vaginal bleeding during pregnancy has many causes. Some are serious and others are not. Bleeding can occur early or later in pregnancy. Bleeding in early pregnancy is common. In many cases, it does not signal a major problem. Bleeding later in the pregnancy can be more serious. But in the real situation naman, when we have bleeding during our pregnancy, bagan mararatol kita. So that is why it is important na if we experience this kind of problem, i-report natin niya may aton healthcare provider para mas maagapan niya. So, as I've said, that bleeding and spotting from the vagina during pregnancy are common.
So what is the difference between bleeding and spotting? So when we say bleeding, gani, it is a heavy blood flow. While ang spotting naman is few drops of blood la nga makikita nimo ha imo underwear.
So, up to 1 out of 4 of all pregnancy women have some bleeding or spotting during their pregnancy. So, what causes bleeding or spotting in early pregnancy? So, the bleeding can be caused by first is having sex. So, other mga doctors gimbabawal niya or not diri dia prohibited but bagan you have to minimize doing mga sexual activities naman kaya it can cause bleeding. The second is infection, and then the third is the implantation, because when a fertilized egg attaches to the lining of the uterus and begins to grow. So sometimes naman Bleeding or spotting in the first pregnancy is a sign of a serious problem, like the miscarriage. So, almost all women who miscarry have bleeding or spotting before the miscarriage. So the second reason naman is the ectopic pregnancy. So when the fertilized egg implants itself outside of the uterus and begins to grow. The third naman is molar pregnancy, when a mass of tissue form inside the womb instead of a baby. Molar pregnancy nga is rare iti ya.
So that is why it is recommended nga magtungha gud kita pramintihan aton prenatal check up kay para as early as possible kung may daman problema imo pregnancy makakabiling irahan treatment para maging normal or healthy ang baby nimo. So there will be no complications sa future imo pregnancy.
So here are the summary of the primary causes of the bleeding during pregnancy. Pero I will not discuss this kay later and ini nga later may da ini ma-discuss. They will discuss this thoroughly. So the next will be the preterm labor. So the preterm labor occurs before the end of week 37 of gestation. It occurs approximately 9% to 11% of pregnancies. So preterm labor is always serious because if it results in the infant's birth, the infant will be immature. So labor is the process your body goes through to give birth to your baby. Preterm labor can lead to premature birth. So premature birth is when a baby nimo is na gimpanganak nimo ya is before pa mag 37 weeks. So your baby needs about 40 weeks in the womb to grow and develop before birth. Therefore, the baby that are born before 37 weeks of pregnancy are called premature, and we all know that mga premature babies nga ni can have serious problems at birth and later in life. So, what are the common signs and symptoms of early preterm labor? So, the early signs are the you experience dullness, low backache, vaginal spotting, a feeling of pelvic pressure or abdominal tightening, menstrual-like cramping, increased vaginal discharge, uterine contractions, and intestinal cramping.
So now let's discuss about the patient teaching of early preterm labor. So the first is continue activities of daily living, but do not lift anything greater than 20 pounds and avoid recreational activities. So do not do any heavy physical activities such as jogging, running, tennis, and frequent trips up and down stairs. You may also have to limit heavy lifting, cleaning, and long trips because they can cause preterm labor. So the next is to avoid sexual activities in the first and the last trimester. So ang iba is ginpabawal kita or gina-advise ang doctor nga dili lang na kita mag-avoid lang na kita ng mga sexual activities, but diri tanan is prohibited diya ito because in most culture sexual activity is not prohibited until the end of the pregnancy. Many Mexican Americans view sexual activity as necessary to keep the birth canal lubricated. So, after is the third is to avoid returning to work if it involves more than 40 hours per week, night shift, prolonged standing, or heavy physical activities. The fourth is to rest in left
side-lying position to improve blood flow to the uterus. So if you are resting on your side, it is a helpful way to keep your uterus relaxed. So consume adequate fluid. So if you are pregnant, it is important nga you have nga to drink 6 to 8 glasses of fluid per day as recommended for adults. And then notify your healthcare practitioner if signs and symptoms are observed. So amon ang yakan ako nga if ma-experience nga ni kami ni mga signs and symptoms pala, notify dayon an aton mga healthcare practitioner kay para maobserbaran ka if you are experiencing na nga a preterm labor. So the last is to keep appointments for prenatal care. So giniyahan ko na dati kanina nga importante talaga nga mutong ta every prenatal care kay to avoid complications aton pregnancy. So now let's move on to the preterm rupture of membranes. So as you can see in the picture, ang baby adaya sulodhan, bagayahan, sakya. So it is called the uterine sac. So a uterine sac is a thin-walled sac that surrounds the fetus during pregnancy. So there are mainly two membranes of uterine sac. The chorion, which is the outer membrane, it surrounds the embryo, the amnion, and the other membranes, while the amnion naman is the inner membrane that surrounds the embryo. So the amnion is filled with the amniotic fluid that holds the embryo in suspension, while the chorion also acts as the protective barrier during the embryo's development. Inside the amniotic sac is the amniotic fluid. So what is the function of the amniotic fluid? So the first is protecting the fetus. So the fluid cushions the baby from outside pressure acting as a shock. So kung habay pahiyaan bagan para maging stable ang baby inside the womb. So the next is the temperature control. So the fluid insulates the baby by keeping it warm and maintaining a regular temperature. The third naman is the infection control. So the amniotic fluid contains antibodies which when there is an infection or mga bacteria inside, hiyaan ma-destroy ito. The fourth is lubrication. So amniotic fluid prevents parts of the body such as the fingers and toes from growing together. Webbing can occur if amniotic fluid are low. And then lastly is the umbilical cord support. So fluid in the uterus prevents the umbilical cord from being compressed. So what does actually preterm rupture of membrane means? So preterm rupture ngani from the word preterm meaning waray paya umabot or before 37 weeks. So a rupture of fetal membranes with loss of amniotic fluid during pregnancy before 37 weeks. So the cause of the preterm ruptured membrane is unknown, but it is associated with infection of the membranes, which is also known as cryoamnionitis. Another complication that can result to PROM is increased pressure from the loss of amniotic fluid. So now let's talk about the pregnancy-induced hypertension. So hypertension is the most common medical problem encountered during pregnancy. So it occurs 5% to 7% of pregnancies. So it occurs mostly often in young women with a first pregnancy. So despite years of research, The cause of the disorder is still unknown, although it is highly correlated with the antiphospholipid syndrome or the presence of antiphospholipid antibodies. So originally, it was called toxemia because researchers pictured a toxin of some kind of being produced by a woman in response to a foreign protein of growing fetus. So the toxin leading to the typical symptoms. So what causes pregnancy-induced hypertension? So first is woman of color or with multiple pregnancy, primiparas younger than 20 years or older than 40 years, women with low socioeconomic backgrounds, those who had 5 or more pregnancies, those who have hydramnios or overproduction of amniotic fluid, and last is those who have underlying disease such as heart disease, diabetes with vessel or renal involvement, and essential hypertension. So, what are the classic signs of pregnancy-induced hypertension? So, the first is hypertension. So, the normal blood pressure of a person is 120/80. So, magkaka-hypertension ka na is considered hypertension if an imo blood pressure is 140/90. So the next is proteinuria, the presence of protein in urine, and then lastly is the edema, an extra fluid in the body. So it is caused by the pressure from the growing uterus that can cause swelling in the ankles and the feet. Pregnancy-induced hypertension is classified as gestational hypertension, mild preeclampsia, severe preeclampsia, and eclampsia, depending on how far development advances. So any woman who falls into one of the high-risk categories for pregnancy-induced hypertension should be observed carefully for symptoms at prenatal visit. She needs instructions about what symptoms to watch for so she can alert her clinician if additional symptoms occur between visits. So now let's discuss about the gestational hypertension. So a woman is said to have a gestational hypertension when she develops an elevated blood pressure which is 140/90 millimeters of mercury, but has no proteinuria or edema. Perinatal mortality is not increased with simple gestational hypertension, so no drugs therapy is necessary. So now guys, take note ha, basta gestational hypertension gani, elevated ang iya blood pressure which is 140/90 millimeters of mercury, no proteinuria or edema. Okay? So now, let's move on to the mild preeclampsia. So, if may nga ni seizure nga mag-occur from pregnancy-induced hypertension, so it is said nga an woman has preeclampsia, but any status above gestational hypertension and below a point of seizure is preeclampsia. A woman is said to be mildly preeclamptic when her blood pressure rises to 140/90 millimeters of mercury. In addition to hypertension, a woman has proteinuria or there is a presence of protein in the urine. Edema also develops as mentioned because of the protein loss, sodium retention, and lowered glomerular filtration rate. Edema begins to accumulate in the upper part of the body, rather than just the typical ankle edema of pregnancy. A weight gain of more than 2 pounds per week in the second trimester or 1 pound per week in the third trimester usually indicates abnormal tissue fluid retention.
This is likely to be the first symptom a woman notices, or it may be discovered when a woman is weighed at a prenatal visit.
So now, take note ha, basta nga ni mild preeclampsia nga ni, and blood pressure is na rise siya up to 140/90 millimeters of mercury. There is a present of protein in the urine, and then a mild edema in the upper extremities or the face. So now let's talk about the nursing intervention for a woman with mild pregnancy-induced hypertension. So client with mild preeclampsia can be managed at home with frequent follow-up care. So the first is to monitor the antiplatelet therapy. The second is to promote bed rest, because when the body is in a recumbent position, sodium tends to be excreted at a faster rate than during activity. Bed rest, therefore, is the best method of aiding increased evacuation of sodium and encouraging diuresis. Rest should always be in a lateral recumbent position to avoid uterine pressure on the vena cava and prevent supine hypotension syndrome. The second is to promote good nutrition. So a woman needs to continue her usual pregnancy diet. At one time, stringent restriction of salt was advised to reduce edema. There is no longer true, because stringent sodium restriction may activate the renin-angiotensin-aldosterone system and result in increased blood pressure, compounding the problem. So last is to provide emotional support. So when a pregnant woman nga maka-experience ito nga mga symptoms, so mafe-feel niya nga baka her pregnancy is at risk. So magkakaada yan anxiety and baguhuna-huna i-premier what will happen. Yeah. So that is why being there for the woman is really important, and to teach her what are the things she needs to do para to treat her condition. Now, let's proceed to severe preeclampsia. A woman has passed from mild to severe preeclampsia when her blood pressure has risen to 160 mm of mercury systolic and 110 mm of mercury diastolic or above on at least 2 occasions 6 hours apart at bed rest, or her diastolic pressure is 30 mm of mercury above her pre-pregnancy level. So, may dagyapon presence of proteinuria level baga nagtitig ka severe na ang presence and proteinuria, and then the extensive edema are also present. With severe preeclampsia, the extreme edema will be noticeable as puffiness in a woman's face and hands. Other symptoms are oliguria, cerebral or visual disturbances, headache, blurred vision, pulmonary or cardiac involvement, extensive peripheral edema, hepatic dysfunction, thrombocytopenia, and epigastric pain. So, in severe preeclampsia, there is a presence of protein in the urine, tas may magdaya edema, but also may pa mga additional nga symptoms. So these are the nursing interventions with severe pregnancy-induced hypertension. First is support bed rest. So with severe preeclampsia, most women are hospitalized so that bed rest can be enforced, and the woman can be observed more closely than she can be on home care. Raise side rails to help prevent injury if a seizure should occur. So darken the room if possible, because a bright light can trigger seizures. Stress is another stimulus capable in increasing blood pressure and evoking seizures in a woman with severe preeclampsia. Be certain a woman receives clear explanation of what is happening and what is planned. Clear explanation helps her accept the need for visitor restrictions and not to cheat on bed rest. Next is to monitor the maternal well-being. So it is important to take the blood pressure frequently or with a continuous monitoring device to detect any increase, which is a warning that the woman's condition is worsening. So may da mga test nga bubuhat ha mother kay in case nga mag-worse nga ni an kuan condition niya, may dahira bubuhaton to save the mother and her baby. The next is to monitor the fetal well-being. Aside from hand mother, it is also important nga you we also monitor the condition of the baby. Kay di ba ang mother and baby is connected. So anything happens and mother is related a baby. It's to support a nutritious diet. So a woman needs a diet moderate to high in protein and moderate in sodium to compensate for a protein she is losing in urine. Intravenous fluid line should be initiated and maintained to serve as an emergency route for drug administration as well as to administer fluid to reduce hemoconcentration and hypovolemia. Lastly is to administer medications to prevent preeclampsia. There are mga drugs or mga drugs na ginhatag ang mother to prevent this condition. For example is a hypotensive drug such as the hydralazine, apresolin, or labetalol, normodine may be prescribed to reduce hypertension. Lastly is the eclampsia. This is the most severe classification of pregnancy-induced hypertension. A woman has passed into this stage when cerebral edema is so acute that a seizure or coma occurs. With eclampsia, a maternal mortality rate is as high as 20%. From causes such as cerebral hemorrhage, circulatory collapse, and renal failure. So the only cure of eclampsia is to deliver the baby. So now let's proceed to HELLP syndrome. So HELLP syndrome is a variety of pregnancy-induced hypertension named for the common symptoms that occur, such as hemolysis, elevated liver enzymes, and low platelets. The syndrome occurs in 4% to 12% of patients with pregnancy-induced hypertension, or approximately 1 in every 150 births. It is a serious syndrome because it results in a maternal mortality rate as high as 24% and an infant mortality rate as high as 35%. Why some women with severe preeclampsia also develop the HELLP syndrome is unknown. It occurs in both prime-gravidas and multi-gravidas. The first symptoms are usually nausea, epigastric pain, general malaise, and right upper quadrant tenderness from liver inflammation. So kung ma-feel nimo nga you are experiencing any of these signs and symptoms, it is important nga i-report mo ya imo healthcare provider kay para they will run some tests to ma-confirm gud talaga nga may da kay ni, and they will give you some treatment to diri maging worse an imo condition. So here is the treatment for the HELLP syndrome. The first is blood transfusion to treat anemia and low platelet levels. Second is the magnesium sulfate to prevent seizures, antihypertensive medications to control blood pressure, and last is corticosteroid medication to help your baby's lungs mature in case an early delivery is needed.
So now let's move on to our next topic, which is the multiple pregnancy. So multiple gestation or multiple pregnancy is considered a complication of pregnancy because a woman's body must adjust to the effects of more than one fetus, and then multiple gestation puts an additional strain on a woman's physical resources and may lead to preterm birth with immaturity of her infants. And the next, the picture shows about the multiple gestation. So there are two types of multiple gestation, which is the first one in letter A, the dizygotic twins showing two placentas, two chorions, and two amnions. And then in the section B, which is called monozygotic twins, which has one placenta and one chorion and two amnions. So, now, unsa na ang monozygotic? Ang monozygotic are also called as identical twin. It begin with a single ovum and a spermatozoon. In the process of fusion, or in one of the first cell division, the zygote divides into two identical individual. The single ovum twin usually have one placenta, one chorion, two amnions, and two umbilical cords. The twin are always have the same sex. So next is ang dizygotic or the non-identical twin. It is the result of two fertilization of two separate ova by two separate spermatozoa, possibly not from the same sexual partner. Double ova twins have two placentas, two chorions, two amnions, and two umbilical cords. The twins may be of the same or different sex. So sa kani nga duha nga mga multiple gestation, ang monozygotic twins has the greatest risk because ang fetus is nag-share sila og vascular communication. So it is possibly leading to overgrowth of one fetus and the undergrowth of the second. So di ba kay ang monozygotic has a single amnion naman siya. So if single amnion is present, there can be knotting and twisting of umbilical cords, causing for fetal distress or difficulty with birth. So because of this complication, ang woman with pregnant with twins must needs closer prenatal supervision than a woman with single gestation para ma-detect ang problem as early as possible. And then, generally, um, a woman carrying more than two fetuses is at greatest risk. So, next is the nursing diagnosis and related intervention. So, nursing diagnosis, fatigue related to increased stress on body functioning secondary to multiple gestation. Outcome evaluation. Client state that she is tired but identifies steps she can take to minimize fatigue. A woman is carrying a double weight during pregnancy, makanotice siya og extreme nga fatigue and backache late in each day. She may have difficulty resting or sleeping than the average woman because of this greater discomfort and increased fetal activity. So, sa magtikadako ang iyang uterus, ang iya pong stomach, magtika-compress pod. So, maglisod na siya og katulog. So, and then, ang iyang appetite is magtika-decrease. To maintain the nutrition of the woman, a mother may need to eat 6 small meals a day rather than 3 large ones. And then, she must be sure to take her iron, folic acid, and then the vitamin supplements. Next nursing diagnosis is fear concerning her own and the baby's health related to risk of multiple pregnancy. In the outcome evaluation is the client accurately state risk of multiple pregnancy, expresses confidence in health care teams' ability to care for her and her babies through pregnancy and birth. With multiple pregnancy has more reason to fear for her life and the life of her babies than does the average woman. So, ang kita naman guro tanan guro batit naman guro sa story about sa mga twins nga ipanganak sila og mga premature og ang uban kani is dili makasurvive og ang uban pod mabatian nato kung unsa gud ka delikado ang pagpanganak og twins. So, if wala pa gani siya, if ang usa ka mother is wala pa nakabatian nga story, dapat maingnan na siya usa ang iyahang due date sa iyahang pagpanganak. So, ato ipaintindi sa iya nga kadto nga mga stories dili lang to buwa-buwa. So, kay tinuod jud nga ang prematurity and high risk to the last-born infant are real hazard in basta't naa ka sa multiple gestation. So, ang dapat nga buhaton is help a woman deal with her fears as positively as possible. It is helpful to tell her it is no indication so far that her babies are in danger. So right now, it is best to continue doing the things that have to be done. If any problem should arise, the healthcare team and a woman's family will be there to support her. So next is the hydram news. So unsa day ng mga hydram news? It is the overproduction of amniotic fluid above 2,000 ml, a condition that can lead to ruptured membranes and premature birth because of increased intrauterine pressure. So, ang amniotic fluid volume during pregnancy is usually 500 to 1,000 ml at term. So, if mulapas na gani siya og 1,000 ml, above 2,000 na, it is called hydramnios. Next is the causes of hydramnios. So, here are the causes of hydramnios. First is the digestive problems that block fluids. Next is the twin-to-twin transfusion syndrome, which is a condition where identical twins share a placenta. And next is the problems with swallowing that may be due to a central chromosome issues, and then heart failure, and the last one is infection. Next, the picture shows a polyhydramnios, which an excessive amniotic fluid surrounding the fetus. Next is the symptoms of hydramnios. These symptoms can occur a bit differently in each pregnancy. This includes the fast growth of uterus, stomach discomfort, uterus that is larger than normal for how far along you are in pregnancy, labor pains, or contractions. Next is the oligohydramnios. So what is oligohydramnios? Oligohydramnios is the lessened amount of fluid and suggests a renal disorder exists in the fetus. Condition may happen for several reasons. It may be due to not making enough fluid, or it may be caused by problems that lower the amount of fluid. So here are the causes of oligohydramnios. First is the water is breaking before you go into labor. Second, poor fetal growth. And then third, your pregnancy going past your due date. Fourth, birth there is a birth defects in kidney and urinary tract problems may be likely. And fifth, and lastly, you are pregnant with identical twins who shares a placenta, which is called twin-to-twin transfusion syndrome. Next is the symptoms of oligohydramnios. First is leaking amniotic fluid, which may caused by the sac breaking. Next is not enough amniotic fluid seen in ultrasound. And lastly, uterus is smaller than expected for how far along you are in pregnancy. As you can see in the picture, it looks like an angry baby. So it is a baby with oligohydramnios complication. The goal treatment of oligohydramnios is to keep you pregnant for as long as it is safe. So the treatment will depend on your symptoms, pregnancy, and general health. It will also depend on how severe the condition is. Treatment may include monitoring, regular checkups, and then delivering the baby if the problem is too risky for you and your baby. You may have to deliver it early. Next is the post-term pregnancy. Post-term pregnancy is pregnancy that extends beyond 42 weeks. As the placenta deteriorates at this time, it can cause a fetus to receive decreased nutrients. Next is these are the certain risks associated with postpartum pregnancy. The chance of stillbirth or infant death increases slightly. Most postpartum term fetus continue to grow and large sizes can cause problems during pregnancy. And frequently, the fetus may not continue to grow and may become malnourished. Beyond term, the fetus is more likely to have a bowel movement called meconium into the amniotic fluid. Next is the prevention and treatment of postterm pregnancy. First is the antenatal fetal monitoring, non-stress testing, biophysical profile, and inducing labor, which is the optimal time to deliver a baby in a pregnancy that is postterm, is sometimes hard to determine. And the next complication is pseudocyesis or false pregnancy. Nausea and vomiting, amenorrhea, and enlargement of the abdomen occur in either an unpregnant woman or a man. Causes of false pregnancy is psychological and physical issues. Psychological factors may trick the body into thinking that it's pregnant. Next is the symptoms of false pregnancy. Women with pseudocyesis have many of the same symptoms as those who are actually pregnant, including interruption of the menstrual period, swollen belly, enlarged and tender breast, feeling of fetal movements, nausea and vomiting, weight gain, and sometimes labor pains. In treating false pregnancy, the doctors must provide psychological support, including therapy, to help the patient with pseudocyesis recover from their disappointment. The next complication is the isoimmunization or Rh incompatibility, which a woman and her unborn baby carry different rhesus or Rh protein factors, and it occurs when an Rh negative mother carries a fetus with an Rh positive blood type, and this condition is preventable. In this condition, your baby may have one or more of the following symptoms if their bilirubin levels are high after birth. So these are the symptoms that may develop in the baby. First is the jaundice, which is a yellowing of the skin and whites of the eyes. Next is the lethargy and the low muscle tone. So next, how is Rh incompatibility treated? Treatment focuses on preventing the effects of the incompatibility. In mild cases, the baby can be treated after birth with a series of blood transfusion, hydrating fluids, electrolyte, which are elements that regulates metabolism, and phototherapy. So, phototherapy involves keeping your baby near fluorescent lights to help reduce the bilirubin in their blood. And this procedure is repeated until the excess bilirubin of the baby's blood is removed. Next is the complication. Severe cases in which the effects of Rh incompatibility are prevented can result in severe complications. So, this complication may include brain damage to the baby, which is known as kernicterus, fluid builds up or swelling in the baby, trouble with mental function, movement, hearing and speech, seizures, anemia, and heart failure. This condition is preventable. If you think you may be pregnant and you have an Rh negative blood type, you should talk with your doctor to determine the best plan for you. And the last complication is the fetal death. It refers to the spontaneous intrauterine death of a fetus at any time during pregnancy. Fetal death later in pregnancy at 20 weeks of gestation or more, 28 weeks or more, for example, are also sometimes referred to as stillbirth. So there are three classifications of stillbirth. First is the early stillbirth, which is the fetus dies between 20 and 27 weeks. Next is the late stillbirth. The fetus dies between 28 and 36 weeks. And the last is the term stillbirth. The fetus dies the 37th week or after. So next is the causes of fetal death. So the causes of fetal death is vital not only for the health providers to know, but for the parents also to help with the grieving process. And these are the common causes of fetal death: problems with the placenta or umbilical cord, high blood pressure or preeclampsia, clotting disorder, infections, birth defects, and poor lifestyle choices. Next is the physical symptoms that the mother have after stillbirth. The mother may have fever, bleeding, chills, and pain. And lastly is the management and treatment. So this treatment is applied if your baby has passed away before you are in labor. So these are the three options. First is the induced labor, second is the natural birth, and the third is the cesarean section. That's all. Thank you for listening.